Wheezing, tightness in your chest, your breathing becomes rapid, and the constant feeling of short of breath. Asthma is the disease in the respiratory system that causes these symptoms. Our respiratory system is important and responsible for sensing odors, aiding in speech, but most importantly, for obtaining oxygen and getting rid of wastes, for example, carbon dioxide. What if you couldn't breathe properly? Sometimes, due to environmental, genetics, and physical factors, our body may attain chronic diseases and conditions such as asthma. So, how then does asthma affect our respiratory system, and where does it come from? Asthma is a disease in the lungs. It affects particularly the smaller airways such as the bronchi and the bronchioles. The mucosa surrounded by smooth muscle is what makes up the inner lining of these small airways. Asthmatics have chronically inflamed smaller airways. This makes them very responsive to certain triggers which are present within the atmosphere in our environment. These triggers are smoke, dust, pollen, fragrances, exercise, and cold weather. When asthmatics are exposed to these triggers, attacks can occur. How do these attacks happen? When an asthmatic is exposed to these triggers, the smooth ring of muscle that surround the bronchiole contract, swell, and become narrow. This leads to a swollen mucosal lining, producing more mucus, making it harder to breathe due to blocked narrow airways. Within normal cases, these triggers that enter the respiratory system are trapped and cleared by the mucus. The excess mucus during an attack causes the excess coughing, wheezing, is impacted by the air trapped in tightened airways, and the smooth muscle contraction causes the feeling of chest tightness. Sometimes, in untreated severe asthma attacks, the body cannot keep up, leading to death due to inefficient supply of oxygen to the major organs, as all the oxygen is trapped in the lungs. How can asthma be controlled or treated? Reducing the presence of triggers is a possible option. However, due to the unpredictable nature of the environment, this strategy is ineffective. Another way is inhalers, the primary treatment for asthma. Inhalers are medications which help asthmatics both prevent and control asthma attacks. They deliver medication along affected and inflamed airways. This medication is in forms of a liquid mist or fine powder. Inhalers come in two forms: reliever medication, which treat symptoms immediately, contain beta agonists, a chemical that widen inflamed airways and assists breathing during an attack. Preventative inhalers contain corticosteroids, a chemical that assists in the long-term treatment. So yes, asthma can be controlled, and it's a very effective method. Inhalers provide both treatment and precaution.